Hello, everybody. Hope you're all well. This is Himanshu Borse. I'm a consultant obstetrician and gynecologist working in the UK. We welcome you to our YouTube channel, and our aim is to increase awareness about various women's health issues so everybody can get educated. In no way we are aiming to diagnose or treat any conditions, and should you require any medical help, please contact either your GP or seek advice from a specialist. Today we are going to talk about urinary tract infections. So a urinary tract infection is an infection involves the urinary tract, which starts with kidneys, ureters, bladder, or urethra. So in the frequency of getting affected, most commonly affected organ is bladder, followed by urethra, followed by kidneys, and the ureters are the least commonly affected organs with any UTI. So what are the common symptoms of a UTI? Burning sensation or pain while passing urine, a frequent or intense urge to pass urine, passing only small amounts of urine, discomfort or pain in lower abdomen, cloudy, bloody, or a very strong smelling urine, a feeling of tiredness or fatigue in the presence of any of the above symptoms, and when it leads to a very widespread infection, it can be associated with nausea, fever, and chills. So, what are the commonest causes of UTI? So, E. coli is the most common bacteria leading to UTI, and it's usually from fecal bacteria entering the urethra. Yeast infection, Candida albicans, everybody is aware of it, is a common cause of urinary tract infections in women. Poor hygiene, such as not wiping from front to back, can increase the risk of UTI because then the bacteria from the skin around anus can get introduced into the urethra, leading to the infection. Blockage, either because of debris or a stone or an enlarged prostate in men, or a tumor which can block the flow of urine and can lead to infection. Sex, any sexual activity can introduce bacteria into the urethra purely because of the way anatomy is. Any kidney defects, lots of people suffer from various kidney malformations such as duplex ureter or wrongly placed ureter in the bladder, and all these abnormalities or defects in the structure of urinary tract can lead to a UTI. Diabetes can increase your risk of UTI through high sugar levels in the urine as well as by suppressing your immunity. And catheter, long-term use of urinary catheter can increase the risk of urinary tract infection. Age-wise causes of UTI. So the most common cause of UTI in women of all ages is still E. coli bacteria from the intestine invading the urinary tract. In younger women, 20 to 39, the most common cause of uncomplicated UTI is sexual intercourse, since the act itself can cause microorganisms from the vaginal region to enter the urinary tract. Other factors include improper wiping after going to the bathroom, use of diaphragms or spermicides for contraception, and tight-fitting clothes because they won't allow any aeration and irritate the skin. In women aged 40 to 64, the most common cause of uncomplicated UTI is still sexual intercourse. Women in this age range may also be at higher risk due to menopause, which can cause reduced estrogen levels in the urine and make the bladder walls more prone to penetration of E. coli and other bacteria. Sometimes these women also suffer from prolapse or cystocele, where they are unable to empty the bladder properly, and that leads to stagnation of urine, leading to UTI. In women 65 or older, UTI caused by E. coli are still the most common, but overuse of urinary tract antibiotics can contribute to the problem. And in men, benign prostatic hyperplasia, which causes incomplete emptying of the bladder, can lead to increased UTI risk. Most common organisms causing UTI, as we discussed earlier, E. coli is at the top, followed very small amounts by Staphylococcus saprophyticus, Klebsiella pneumoniae, Proteus mirabilis, and Enterococcus species. So when you get a patient with urinary tract infection, what investigations one does is urinalysis, where you try and get a clean catch urine sample and send it to the lab, or nowadays you get urine dipsticks which can tell you the traces of leukocytes, blood, or nitrates. Nitrates are more found during an active infection, and it gives you much better idea about the pH of the urine as well. Urine culture, we send this sample to the lab where they try and grow organisms from the culture and also check the antibiotic sensitivity of these organisms, so you could prescribe proper antibiotic to eradicate the infection. Sometimes the stool sample might be needed if a UTI is suspected to have spread to the intestine. Ultrasound scan will look at the kidneys, ureter, bladder to look for any stones, any structural malformations, residual volume, and any changes in the walls of the bladder. And a cystoscopy, where a camera is introduced in the bladder, it gives a better look at walls of the bladder, and we can see any bladder stones or erythema, and sometimes it enables us to take a biopsy as well from the bladder, which helps in the diagnosis. UTI in pregnancy is a particularly common problem because with pregnancy, hormones and the changes in the pelvic and abdominal pressure, the ureters become more vulnerable for reflux, and that can lead to increased risk of UTI in pregnancy. And at any stage of pregnancy, UTI is not very nice to have, and if not treated properly on time, it can lead to various complications such as septicemia, premature labor, or IUGR in certain cases. Treatment of urinary tract infection. Usually we recommend you drink plenty of water so your urine is dilute and helps to flush the bacteria with multiple passages of urine. Urinate when you need to. So it is quite common when people are unable to void when actually needed, and that actually leads to prolonged stagnation of bladder and the bacteria can multiply. Use a heating pad which helps in pain in the lower abdomen. Practice good hygiene, especially when you have a UTI, to help reduce your risk of spreading the bacteria. And be sure to wipe from front to back after using the bathroom. Wash your hands and take recommended medication, because most of the times a broad spectrum antibiotics is prescribed, but sometimes once we have the results of antibiotic sensitivity, we prescribe you the antibiotic which is most likely to eradicate the bacteria. Hence, to complete the course of that antibiotic is very important so it doesn't happen again. Thank you very much. I hope you enjoyed our little talk, and if you have any queries, please do let us know. And if you have any particular topic to be covered, please mention it in the comment section and we will try and talk about it. Thank you.